control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Ageless Health with me, yours truly, Dr. Tom Roselle. Got another great program for you today, one that just give you all kinds of information, both guys and women. We're talking about osteoporosis, when you lose all that bone density and it kind of goes down the tubes. Well, it's an important situation. We just finished kind of giving you the brief on it on WMAL 105.9. And what we want to make sure is that now you know that there are possibilities that can begin to reverse that. It's not consistent with old age. It seems to show up that way because we abuse our bodies up until that point and we don't take care of ourselves. And we start putting, if you will, plugs in the symptom process. What do I mean by that? A plug is something that dumbs down the symptoms so you can live with it, so you don't have to complain about it too much. So in this situation, talking about osteoporosis, we're talking about things that suppress the loss of the calcium from your bones, because that's what osteoporosis is. It's a significant loss of bone density. And so we want to make sure that you get that. You understand what it really is. If you get about a 15%, 20% loss of bone density, and that's pretty significant. Think about that. That's, oh, wow, that much? That's called osteopenia. And as soon as you get into that 30% marker, a little bit more, about 30%, 25 to 30%. Now you're in osteoporosis. Some of the literature says a little bit more than that. But let me tell you something. You start losing that calcium, and the support systems, the bones in your body are going to suffer. But guess what else suffers when you don't have enough calcium the right way? The muscles in your body are going to ache and hurt like crazy. Your mind's not going to work because you need trace amounts of calcium. What else is going to happen? Your heart's going to start flipping around. You get this tachycardia crap that's going on. And if the calcium's coming out of the bones, the tendency is that it's going to go into your arterial beds, and you're going to start plugging things up. Now, I don't know about you, but it's not something that I want to do. So wouldn't it be good to know that it's reversible in the greatest majority of conditions? We talked a little bit on the first part of the program that it has to do with drops in estrogens. Well, we know that when guys, you go through andropause, and women, you go through menopause, that estrogens begin to drop down. But here's the deal, guys. Yours shouldn't. You should be consistent all the way through because you're not producing it from your ovaries because you don't have an ovary. I hate to tell you, but you don't. No, those of you that are out there, never mind. I didn't say that. I don't want to get to that area. So when you're dealing with a drop in estrogen for a man, you have to look at this outer shell of a fight-flight system called the adrenal cortex, or the shell around the adrenal glands that sit on top of the kidneys. That produces estrogens and progesterones and testosterones. Ladies, your adrenal system begins, the outer shell expands just a little bit as you go through menopause to produce the estrogens, progesterones, and testosterones that you need. But if that isn't working the way it's supposed to, if you're stressed out like crazy for a lot of reasons, pain that you've been in for a long period of time because it's going to affect that's your fight-flight system. If it's because you're stressed out emotionally, your brain won't stop worrying and doing things like that, that can cause that thing to be overwrought. Or simply, biochemically, you're not supplying what you need to have for that to work. And remember, if you listen to the first part of the program, we talked about the other piece of the puzzle is the parathyroid. The parathyroid is really the master control mechanism of putting calcium in and taking bad, dead calcium cells or bone cells out, not calcium, but bone cells, right? It takes it out. It's called osteoclastic and osteoblastic formation. Now, so when we have too much osteoblastic opposed to osteoclastic, now we have an imbalance, and that imbalance is going to cause your bone density not to be good. And I said earlier on in the program, if we look at a man and we see that his calcium level is too high in his blood, the first thing that we're going to do is that we're going to run a parathyroid test. Now, parathyroid is the control mechanism. What do they usually do after that? Say, oh my God, if it doesn't come down, they may give you some medication that will help drop it, but it's suppressing function. So it suppresses function throughout the rest of the body. They're going to do what? They're going to cut the parathyroid out because they're thinking that it's hyperactive because of a tumor, because whatever, and it's not working the way it's supposed to. So let's get rid of something that's not working instead of trying to fix it. Well, there's ways of making that parathyroid work the way it's supposed to. So we're going to touch a little bit about this whole mechanism. But on the 13th of November, coming up in a few weeks from now, join me at the Roselle Center for Healing and Dr. Stephanie Pina. Many of you know Dr. Pina. She's a really excellent doctor of naturopathic medicine and knows her stuff really, really well. And we're gonna play with this a little bit. I'm going to get into very in depth on how to change things. But let me give you a couple clues, right? So what can you do to fix osteoporosis other than looking at hormonal function? I'm going to look at hormonal dysfunction, and we're going to try to put that piece in, but just little things. How many of you exercise at least 4 to 5 days a week? And when I talk about exercise, I'm talking about a little bit of weight resistant exercise. How many of you do that? Raise your hand. And if your hands aren't going up, then you're putting yourself in a place where you're going to be more susceptible to things like osteoporosis. And guys, same thing with you. How many of you just sit on your fat butt all day long and you're flicking the remote, or you're at work, you don't go anywhere? The furthest place you go is down the hall to go to the bathroom. And, that's not a great thing either. Or we've talked about in the past, do you take the elevator everywhere and you're in the car and you go from the house to the car? You're setting the stage for a problem. My family, many of you know that I'm first generation of this country. The old timers, they used to work all the time. They come home from work, they go play in the gardens, they mow the lawns, things like that. If you're a city dweller, how many of you are getting, the guy down the street, the kids, I would say, used to be, right? Not anymore. They don't want to work. But the guy down the street to mow your lawns. And so if that's the case, where's your exercise? Even doing something like that. Are you lifting and carrying things? That's exercise. Or are you getting somebody else to do it, or you don't do it, you accumulate it and just you're doing that? So if that's the case, how can you increase your exercise? It's called get your butt up in the morning and go for a walk, and put a couple weights in your hands, like a pound on each one, and maybe put 2 pounds. They got strap-ons, and I don't mean that kind of strap-on, but around your ankles, and you can go for a walk. And you start out with 10 minutes out and 10 minutes back, 5 minutes out, 5 minutes back. And then you add it. And then pretty soon you get yourself up to where you're doing 15 minutes out, 15 minutes back, and you increase your pace with these weights in your hand. They're very light. We're not talking about, even if you just put them in your, these wraparounds on your wrist, right? A pound. So you've added 2 pounds. Great. Okay. Now put the ones on your ankles. Or they make these jackets now, these weighted jackets. You can get them up to, 20, 30, 40 pounds. It's the resistance that's put to your body because of the weight that you now carrying around that you weren't carrying around, that'll increase the demand for calcium in your bone density. So you can do that, right? How many of you drink way too much? What do I call about drinking way too much? Well, it's called more than maybe a glass of wine with dinner, or maybe a drink, guys. Alcohol, you more easily break it down, but is it more than an ounce? We go home, relax, and up there. Now, you notice I'm not saying don't touch it, don't drink it. I'm just telling you what the rules are here. I have opinions on them, but right now we're talking about rules. So how many of you are doing that? And I'm not talking about white wine. Sugar level's way too high. We're talking about a glass of red wine that's dry and it's outside of this country. So how many of you drink more than that on a regular basis? How many of you are not getting enough vegetables in your diet, right? So how much vegetables? Well, between a serving of fruit and the vegetables that you should eat, you should be getting 8 servings a day. What's the serving? It's a half a cup. That's only 4 cups of vegetables and maybe, a half a cup of fruit. And berries is the best ones for you, by the way. And so we do that. How many of you are getting the right oil? So we're giving you little tidbits that really work. And on the 13th, when you come in, we're really going to go after this. And I'm going to put this pattern together for you. And we're going to really make that happen. So a little bit of exercise, making sure you're getting all the junk out. How many drink sodas? Like any of the colas and any of the stuff that fizzes and carbonates. Let me tell you what you're doing to your body. That's called phosphoric acid. Phosphoric acid is highly, highly eroding to your body. So your body has to protect you. How does it protect you so you don't put a hole in your heart and eat your organ systems up and things of that nature? How does it protect you? It has to buffer it. It has to take it to neutral instead of an acidic platform. Where does it get that neutral element for, that alkaline element? It's from your bones. It pulls the calcium out of your bones. And when it does that, right, to buffer it, you still have free-floating calcium around. So what other problem can come around because of osteoporosis? It's called cardiovascular disease, calcific hardening of the arteries. So if you want those arteries tight and stiff and say, oh my God, they're closing up, that's one piece. Stress patterns will do the same thing. We talked about that just a little bit and so forth. How many of you start out your day with a little prayer or, maybe about 20, 25 minutes of meditation and so forth? I had a patient the other day, very, very a Christian woman and said, "What do you mean you meditate in the morning? That's the devil's work." No, it isn't, because I look at my vision is when I close my eyes, I see a cross in my brain, and I sit there and just it's all incoming, right? So let's not get all jacked up when it comes to talking about meditative patterns and doing those things. Get quiet, and then guess what you do next? Then you exercise a little bit. Then what you do next? Then you eat well. You don't go get a box of Cheerios or anything like that, or a piece of white bread and put some, peanut butter on it that has tons of sugar in it and things. You go and say, "Oh my God, you're taking my breakfast away from me," or get a donut or a couple of cookies and a cup of coffee and out the door. I promise you're setting the stage for a worse scenario that you don't want to have to deal with. So let's kind of look at little things that could make a difference. How many of you get enough vitamin D? You go to the doctor. Here's the deal, right? And see, without vitamin D, you can't metabolize calcium and you can't stay in your bone anyway. So how many of you, look at your blood work and your doctor says it's normal, but the vitamin D level is like 38, 42. And he says, "Yeah, you're fine," because you're within the laboratory normals of 32 to 100. And those are not normal values, by the way. The functional medicine values go up to about 140. And your doctor says, "Oh my God, that's way too high." And if they do give you vitamin D, they're going to give you disulfiram, which is D2, and the one that you really need is D3. So how many of you, are looking at lower levels that the laboratory considers normal? I'm telling you that if your vitamin D level isn't north on an ongoing basis of 50, now we're not even talking immunological function, we're just talking about bone density, that you have a problem. And then there's many other nutrients that are important to metabolize calcium and keep it in the bone. But the first thing that we're going to look at, you need a little vitamin C. You got to make sure your protein levels are high enough so you're getting the right type of collagen in your system and the like. So we want to make sure that you have everything it takes so these holes in your bones, right, don't show up. And because then you fall down, you go, oops, boom, and you break something. That's not the way it's supposed to be. You're not supposed to do that. So here's the deal. When you look at age, is age a risk? No, it's not a risk in of itself. It's just that as we get older, it's the things catch up with us that we should have been doing all along, but we're not doing them. How many of you are smokers? And that's going to increase your risk significantly of developing osteoporosis over a period of time. So women, more susceptible than guys are, but guys, you have the problem too. You just don't realize that, the risk has been there probably longer than women. That's one of the reasons that you get all the heart problems. That calcium is coming out of your bones and it goes directly to the soft tissue called your arteries, and it starts plugging them up. And it's not so much the fat. We need fat. We need cholesterols. It's just what else is hanging there that this stuff is clicking to. So your fat buffers, by the way, that acidity we just talked about a little while ago, you have that too. So body weight is important. If you're way too thin, you increase your risk of developing osteoporosis, ladies. So it's, thinning all it's cranked up to be. So if you're looking to look like that and say, "Oh my God, I'm way too fat because I'm 2 pounds overweight," and you try to go the other way, it's more of a problem. So you have to make sure you understand that, and you just don't drop that weight down. A little extra weight sometimes, as long as it's muscle weight and you get that exercise that we talked about, is really a very good thing. If you have a family history of osteoporosis, it's probably because it's not a genetic, some of it can be, but more likely it's because you live like your parents lived and you ate like they ate, and so you increase your risk. So you start seeing falls and bumps and bruises that can cause a problem. Predispositions to cancer, strokes also increase the risk of osteoporosis. And there's certain cultures that increase the risk, particularly if they've moved out of their normal areas. So people of color have an increased risk of osteoporosis. And why? Why would that be? Think it through. What did we just talk about a moment ago? We talked about vitamin D, right? So, that beautiful skin color, the darkness is gorgeous. But why would that increase the risk? because that skin color is there to protect them from burning, because where they live is generally in areas where the sun is much more direct. So the body has been designed, good Lord designed it to protect it. But when they move into areas where they don't get as much sunlight, their risk increases because their vitamin D storage, the vitamin D level goes down. The sun no longer is able to stimulate deep down inside that tissue. So you've got a lot of things that we don't think about. And there's certain medications like steroids. How many of you have been on steroids for a long period? That's going to take the bone density and drop it down. So we look at prednisone. We look at other types of drugs that can cause problems across the board. If you've ever had radiation, if you've ever had a cancer, the radiation itself will cause a problem. And it causes your body to lose the calcium density. So be very tuned in to what's going on and the things. So we have to look at, we want to stay away from the medical pieces. We want to stay away from the bisphosphonates. We want to stay away from the things like the Fosamax and the Vista and the Boniva and all those things, because they can cause other problems. Let me tell you what they do, first of all, so you really get it. They don't put new bone back in. What they do is they stop the dead bone from leaving. So you start developing this fracture increase. Why is that? Because it strengthens the bone vertically like this. So if you put weight on it, it's stronger. But that's not how fractures happen when you fall. It is across the bone. So it actually increases the risk of fracture in certain situations. So we have to make sure. And then there are certain types of calciums. Yes, calcium is good for you, but it has to have certain cofactors, like what? Like our vitamin D, like in the enough hydrochloric acid in your stomach that will allow it to absorb. You have to have that. Otherwise, it's a problematic situation. You got to have a little phosphorus in the system. You got to have the list will go on significantly. We could actually sit here and just keep adding to it. But the problem is it comes down to dietary patterns as well. And that's where the problem is. We miss those things. A little bit of zinc, a little bit of selenium. Those are critical in making sure that bone stays strong. We also know that zinc is what? Zinc is immunological supportive. And it's going to go to protect you first immunologically before it goes to protect your bone. There's a mineral called strontium. And that strontium and zinc and selenium and calcium and the right type of magnesium, the right type of calcium, not just, oyster shell calcium. You can't break the damn thing down, but you can do it with other situations. So good hydrochloric acid production, exercise, eating enough proteins and vegetables in your diet, stay away from the garbage that's going to cause acidity. And then finally, something called K1 and K2. Big conversation now about K2. K2 is critical in maintaining the bone density. The technical term is megaquinone. And it's actually, if you look it up, it's megaquinone 7. So do your homework, check it out, and see what it really was all about. But there's where you go. So each one of those are different. We've got to check the parathyroid. We've got to check the dietary patterns and make sure you're not on fire, acidity, those like we said about colas and things like that. We have to make sure that your coffee level is adequate, but you're drinking enough water to buffer it, and very low levels of an acidic coffee. There's some decent stuff out there. You got to drink coffee. Go to something like Pure Roast. The acid level is really, really low. Does a nice job across the board. I think you might even be able to get it on my website. Go to drtomroselle.com. Go to Ageless Health Store and check that out. So I hope I'm helping you with this. I'm hoping that I'm pointing you in the right direction. There's a lot that can be done. You have to find out, where that body pain is coming from. You have to find out why you're bent over all the time. You have to find out, what is the underlying problem that you've had repetitively over a period of many years. I promise you, most of these conditions are highly reversible unless it's a cancer and so forth. That's a different conversation we can have, and there's things that can be done to support you along those platforms. But osteoporosis, 25 to 30% loss of bone density. If you fall down, you're going to break something. So wouldn't it be great to begin to get in a lifestyle that is supportive to you, that'll bring your energetics up, that'll stop a lot of this from happening, including coronary plaquing? Wouldn't that be great? Well, I'm here to tell you that it can get done. Go to drtomroselle.com and go to the Ageless Health Store. We've got some things sitting there, but don't forget, join me and Dr. Stephanie Pina on the 13th, coming up in a couple of weeks. Life goes by very, very, very rapidly. And make sure that you register. You can register at drtomroselle.com. You can register by calling the office at 703-698-7117. And we'll put this all together for you in a way that it'll change your life. I promise you. Why hurt? Why lose your height? Why feel like you can't do what you used to do? Why get those terrible, bent over spinal observations that your doctor says, well, you have an increased kyphosis. Well, why did you get it in the first place? Well, you can get it because the disc shrinks, or you can get it because the bone's breaking down. If the bone's breaking down, you've got other problems on top of that. And it can lead to other things like stones anywhere, urinary stones, kidney stones. It can lead to gallbladder stones. It can lead to building up calcium within the arterial bed or in your brain. And you start not thinking the way you should start thinking or have been thinking. So join me coming up very quickly on the 13th of November. And by the way, by that time, we're going to know what the outcome is, this craziness of the next few weeks, right? That's a whole different story. We're going to talk about stress at some point and kind of weave it into all of our things. Join me. We have a great time. I promise you I'll answer all your questions. In the meantime, if you have a question, write me at drtomroselle.com. And I promise you I'll answer you. I always do. And I'll give you my opinion. And you take that opinion and, let's see what we can do about it, okay? Anyway, remember, I'm here on an ongoing basis for you for one reason only. Simply this. You deserve the information, but more importantly, I love you all. You have a great Sunday. I'll see you next week. Bye.